Most people hear the word anterolisthesis and immediately think their spine is slipping so far forward that surgery is the only thing that can save them. But what if that fear is not the full story? Before I show you exactly how Chiropractic BioPhysics helps realign a forward slipped vertebrae safely, let me start with 3 quick stories from patients just like you who were told their only option was a scalpel. Evelyn came in with a 10 millimeter anterolisthesis at L5-S1, exhausted, discouraged, and being managed by a pain clinic that gave her no hope of correction. After 3 months of non-surgical Chiropractic BioPhysics-based traction, stabilization work, and home orthotics, her forward slip improved by 4 millimeters. Her mobility improved month after month, and she is now on track to reduce and possibly eliminate her pain injections. Most importantly, she's beginning to believe in her future again. Jenny, a family counselor, could not sit through a full counseling session without standing to stretch several times. With non-surgical CBP traction and targeted stability work, she can now sit comfortably through her sessions without interruption, and she got her professional confidence back. Peter, an avid gardener who had completely stopped gardening because bending and uneven ground triggered pain. He began non-surgical CBP correction, stabilization work, and today he's back in his garden, pain-free, fully engaged, and reconnecting with something he loves. His joy and daily fulfillment returned because his spine finally had a safe path forward. These stories are not outliers. They show what happens when you stop treating anterolisthesis like a life sentence and start understanding it as a mechanical problem that often responds to the right conservative strategy. In this video, you'll finally understand what a forward slipped vertebrae actually is, why so many people are told surgery is their only option, and the structural signs that actually matter. I will show you the evidence-based CBP corrections I have used for more than 30 years, including the imaging, the traction methods, and the stabilization work proven to reduce vertebral slip safely. And you will get the exact conservative plan people use to start stabilizing forward slip today, including what movements to avoid and what makes the slip worse, and the simple exercises that rebuild confidence and reduce pain without fear. By the end, you'll have a clear, structured roadmap for avoiding unnecessary surgery and getting back to the everyday things your back and leg pain have limited, such as walking longer distances, climbing stairs, standing to cook, traveling, gardening, and sitting comfortably through family events. If you have ever felt dismissed or scared about your spine, stay with me because this may be the first time someone shows you a path that helps you move again, feel safe again, and reclaim the normal activities your pain has been holding hostage. Hi, I'm Dr. Jenkins, a corrective care chiropractor in Kelowna, British Columbia. For over 30 years, I've helped people restore their health, mobility, and confidence through advanced, non-surgical spinal rehabilitation. I'm one of only a few doctors in the world who are advanced certified in chiropractic biophysics, and one of just 3 on the west coast of Canada. My mission is simple: to help people live strong, active, and pain-free lives for as long as possible. I do that by focusing on real correction, not just pain relief, helping people fix the root cause of spinal problems that have held them back for years. On this channel, you'll find clear, evidence-based videos that explain how your spine and nervous system work, why posture matters, and what you can do to move and feel better naturally. If you're ready to take control of your health and start moving without fear again, subscribe to the channel. You'll discover practical, evidence-based ways to correct your posture, protect your spine, and keep your body strong for life. I upload a new video every week. When most people hear the word anterolisthesis, they picture a vertebrae slipping forward and getting worse every day. That alone can create lots of fear. So let's make this simple and take some of that fear out of the equation. Anterolisthesis means one vertebrae has shifted slightly forward in relation to the one below it. That shift changes how forces move through your spine, which can lead to pain, stiffness, nerve irritation, and gradual stress on the disc at that level. But here's the part that most people never hear. In many cases, this is a mechanical alignment issue. It's not a sign that your spine is collapsing. It's not a guaranteed decline. And it does not automatically mean surgery. Once you understand that this is a structural problem with a mechanical explanation, the diagnosis becomes much easier to make sense of. It has patterns, it has measurable findings, and it has conservative solutions that can stabilize it safely. I will show you these solutions in this video, so keep watching. Now that the diagnosis itself feels clearer and less threatening, the next question is, why is it delivered in a way that leaves so many people feeling overwhelmed or frightened? Let's break that down. Most people are not overwhelmed by the diagnosis itself. They're overwhelmed by how it was delivered. Many first hear the word anterolisthesis in a rushed appointment. A doctor points to the image, says it's serious, and the discussion jumps straight into injections or surgery. That moment creates fear and confusion. You may leave feeling intimidated, dismissed, or pressured into decisions that don't match your goals. Almost everyone walks out believing their spine is fragile, on the verge of getting worse. Hey, those feelings are real, but they don't define your future. They reflect how the information was presented, not what your spine is capable of. For many people, the hardest part of anterolisthesis is how it changes daily life. Walking starts to feel guarded. Gardening or hiking becomes something you avoid. Standing to cook flares your back. Travel feels risky. Even sitting through a family event becomes uncomfortable. These losses build up. They affect your confidence and make your world feel smaller. The fear of making things worse often becomes stronger than the desire to stay active. But these limitations are not permanent. They do not mean your body is failing. They usually mean your spine needs guidance and a plan that matches its mechanics. With the right approach, many people regain the activities they thought were gone for good. Most people are never told this, but a forward slipped vertebrae does not automatically mean surgery. Many cases respond extremely well to the right conservative plan, especially when the plan is based on structure, not guesswork. Getting a second opinion is normal. Exploring non-surgical options is appropriate, especially if you want to stay active and avoid long recoveries. The problem is that most patients only hear the medical route and assume it's the whole story. There is another path, one based on biomechanics, measurement, and guided correction instead of symptom chasing. A path that looks at how your spine moves, how it loads, and what direction it needs to stabilize. If you have never heard of this kind of approach, you're not alone. Most people have no idea it exists. So let me show you what makes Chiropractic BioPhysics, or CBP, different, and why it's helped so many people who were told there was nothing left to try. Most people are used to quick checks, general stretches, or generic exercise sheets. That approach does not work for anterolisthesis. It can even make the slip worse. CBP takes a completely different path because it starts with structure, not symptoms. CBP uses weight-bearing x-rays, digital posture analysis, and precise biomechanical measurements to see exactly how far the vertebrae has shifted and what direction it needs to move toward. Nothing is guessed. Everything is measured. One of the biggest differences is the use of the full mirror image system. That includes mirror image posture correcting exercises, mirror image adjustments, and mirror image traction. Together, these guide the vertebrae and the surrounding soft tissue toward a more stable position, instead of letting the spine drift into patterns that increase shear. CBP also takes into account what not to do, which is critical for anterolisthesis. Many people unknowingly worsen their instability in yoga, Pilates, group fitness classes, or even with well-meaning trainers. Extension movements and deep back bends increase towards shear. And once you understand that, your pain patterns begin to make sense. This is where the RoboTrack traction system becomes especially powerful for anterolisthesis. In our office, we use a doctor-controlled traction system called RoboTrack, designed specifically for structural spinal correction within the CBP protocol. It uses 5 electric actuators that can control 10 different table movements. This allows us to apply precise, targeted forces that gently reduce forward shear on the slipped vertebrae while supporting and unloading the surrounding discs, joints, and ligaments. Every setup is customized based on your x-ray findings. Because the doctor controls every movement in real time, the traction can be fine-tuned for both comfort and safety. Now, this level of precision is especially important for an unstable segment that cannot tolerate random or high-force traction. We are currently the only clinic in Western Canada with a RoboTrack, which gives our patients access to a rare and highly effective corrective technology. Now, before we go any further, I want to show you something that most people with anterolisthesis never hear about. There is real published peer-reviewed research showing that structured chiropractic biophysics rehabilitation can reduce a forward slip and keep those movements long-term. In 2024, Dr. Kurt Vachorek and his team published a case series in the Journal of Clinical Medicine. They worked with 3 older adults who all had significant lumbar, lower back, anterolisthesis. Their average slip measured 14.5 millimeters before care. Using CBP structural rehabilitation combined with RoboTrack traction, the average slip dropped to 4.2 millimeters. That's a significant change and improvement. And it didn't stop there. Back pain dropped from severe to mild. Urinary urgency improved. Quality of life scores went up significantly. Most important, when the researchers followed up more than a year later, every improvement was fully maintained. This case series shows that targeted structural rehabilitation can create real, measurable, long-lasting spinal correction without surgery. When it comes to stabilizing a forward slipped vertebrae, you need more than stretches and trial and error exercises. You need a plan that makes sense, a plan that respects the mechanics of your spine and gives you a predictable path from where you are now to where you want to be. The first step is always a detailed assessment. Not a quick glance, but a real look at how your spine is aligned and how the anterolisthesis is causing your symptoms and affecting your day-to-day activities. That includes a conversation about your history, your goals, and the fears that you've developed along the way. Then we use weight-bearing x-rays and posture scans to measure exactly what is happening. From there, we build a personalized corrective plan that focuses on stability and safety. This is where CBP, RoboTrack, and the corrective care mirror image system comes in, including mirror image exercises, mirror image adjustments, and mirror image traction. These procedures guide the vertebrae towards a more stable position instead of letting it drift further forward. Every exercise we give you is designed to avoid shear, avoid extension, and avoid the movements that make your instability worse. The process happens in phases. First, we calm irritation, then we restore mobility, then we build the strength that keeps the slip from returning. And as your spine changes, we recheck everything. Progress is measured, nothing is guessed. Many people assume that correcting a forward slipped vertebrae has to be complicated or painful, but it usually is the opposite. Once you start using these corrective methods, your body calms down instead of flaring up. That alone creates early improvements in many patients. Most have not felt in years. The exercises we give you are simple, no twisting, no deep bends, no heavy loading. Most can be done at home in under 20 minutes. They're gentle, controlled, and based on movements your body will tolerate. You only progress when your spine is ready, not because a program tells you to. Everything is personalized, so you never have to guess. We track your changes with posture scans and imaging, which gives you clarity and removes a huge amount of fear. Most patients are surprised by how quickly they feel more stable and more confident. Not because the correction is complete, but because they finally understand what their spine needs. After years of pain and mixed advice, it's natural to think that your options are limited. That's why our structured approach often surprises people. The first change is simple. Fear drops. Once you know which movements help and which ones irritate your spine, you stop worrying about making things worse. That alone helps your body move better almost immediately. Then comes clarity. Seeing your imaging and following a plan built around your mechanics gives you control again. Many patients have not felt that in a long time. Next, the small wins show up. Better mobility, less tension, more confidence with everyday tasks. These improvements appear early because your spine is finally moving in a stable direction. And the biggest shift is hope. People start to picture a future where they can move with confidence instead of guarding every step. We covered a lot in this video about anterolisthesis and how we use chiropractic biophysics to help realign a forward slip vertebrae safely and without surgery. Always remember this, anterolisthesis is not a life sentence. Your spine is not failing and you are not out of options. With the right non-surgical chiropractic biophysics corrective methods, real structural improvement is possible. I have seen people who felt hopeless regain mobility, confidence, and control of their lives again. You can move toward that same outcome. You can move better. You can feel safe in your own body again. And you can get your life back without surgery. If you found value in this video, like it and share it so more people dealing with this condition can finally get clear, hopeful guidance instead of fear and confusion. If you have an anterolisthesis and want this type of treatment, look for a Chiropractic BioPhysics certified doctor in your area. And if you need help finding one, drop a comment below and I will point you to an online directory of trained and certified CBP providers. Make sure you subscribe so you don't miss the practical evidence-based videos that help you correct your posture, protect your spine, and keep your body strong for life. And if you want a simple place to start right now, the next video you should watch is the 5 best exercises for anterolisthesis L45 to ease back pain and leg pain at home. Go watch that video next.